Okay, guys, this afternoon for topic B, because of Elder Abuse Awareness Month, I've done a presentation for y'all. So let's get to it. Topic is the abuse, neglect, and exploitation of older adults. Okay, so that's what we're discussing for B. Okay, here we go. I appear before you not only as a health system executive, but as someone who has spent years listening to families, caregivers, and frontline staff. I have seen the quiet injuries that never make the news. I have seen the fear in the eyes of older adults who cannot articulate what is happening to them. I have seen the profound relief when someone finally intervenes. The scope of the problem: elder abuse is not rare. Nationally, 1 in 10 older adults experience some form of abuse, neglect, or exploitation each year. Yet experts agree this is a severe undercount because most cases go unreported due to fear, cognitive impairment, or dependence on the abuser. The scale of harm is staggering. Between 2022, between 2002 and 2016, more than 643,000 older adults were treated in emergency departments for non-fatal assaults, and 19,000 homicides occurred. Rates of non-fatal assaults increased by 75% among men and 35% among women in 2022 alone. Violent injuries against older adults cost the United States $33 billion. These are not abstract numbers. They represent real people, our parents, grandparents, neighbors, and future selves. What elder abuse looks like in the real world. In my health system, we see the same patterns again and again. Unexplained injuries, bruises, fractures, burns, paired with stories that do not add up. Sudden withdrawals or fearlessness, especially around a particular caregiver. Malnutrition, dehydration, and untreated medical conditions, often the result of neglect rather than malice. Financial exploitation. Now one of the fastest growing forms of abuse. DOJ reports that its most recent enforcement period perpetuators attempted to steal or did steal over 2 billion from more than 1 million older Americans. Isolation, which is both a risk factor and a tool of control. We also know who is most likely to commit abuse. Family members account for nearly 6 in 10 cases. And most abuse occurs in private homes, not institutions. Why cases go unreported? Most older adults do not report abuse. They fear retaliation. They fear losing their independence. They fear getting a family member in trouble. Many simply cannot report because of cognitive impairment or disability. Frontline professionals, nurses, home care aides, social workers often see the warning signs but lack the training, time, or legal clarity to act confidently. This is why policy matters. Without strong systems, even the most vigilant communities cannot protect vulnerable people. Pennsylvania's current system, Pennsylvania Protective Services System, is governed by the Older Adult Protective Services Act, or OAPSA, and administered through 52 area agencies on aging across all 67 counties. Reports of alleged abuse are documented as reports of need, or RONs, and investigated by AAAs. But the system is strained nationally. APS programs receive 1.5 1.53 million referrals in FYI 2023 and conducted 876,236 investigations. Pennsylvania state of this burden is significant. And without our workforce, like the national APS workforce of 9,040, hotline investigator staff is stretched thin. We cannot expect the system to function well when demand outpaces capacity. Policy recommendations to strengthen protections for older Pennsylvanians. I urge the General Assembly to consider the following actions: increase APS funding to ensure timely investigations, adequate staffing, and specialized training. Standard to standardize and expand mandatory reporter training across all care settings, including home-based services. Create a standard create a statewide data case tracking system to identify trends, repeat perpetuators, and systematic risks. Strengthen financial exploitation protections by partnering with banks, credit unions, and law enforcement. Invest in caregiver support, respite care, training, and mental health resources to reduce unintentional neglect. Expand community based prevention programs such as senior check in circles, home safety assessments, and public education campaigns. Improve cross agency coordination among health systems, law enforcement, aging services, and financial institutions. These are not ethical improvements, are three theoretical improvements. They are practical, evidence-based steps that will save lives. The moral imperative. Even older, every older adult in Pennsylvania deserves safety, dignity, and respect. Elder abuse is not simply a social service issue, it is a public health issue, a law enforcement issue, and a moral issue. When we fail to protect our when we fail to protect older adults, we fail the very people who built our communities, raised our families, and sustained our economy. We fail we fail our own future selves. But when we strengthen systems, support caregivers, and empower communities, we send a clear message. Pennsylvania protects its elders. Integrated statistical appendix. National prevalence. 1 in 10 older 1 in 10 older adults abused annually. 643,000 non-fatal assaults. Emergency department visits. 2002 to 2016. 19,000 homicides of older adults in 2002 to 2016. 33 billion in violent injuries costs. 2002 APS system data 1,530 well 1,531,000 766 referrals of alleged uh, ma- mal- maltreatment. 2023. 876,236 investigations conducted. 9,040 APS professionals and 2,206 supervisors nationwide. Financial exploitation, 2 billion stolen or attempted from 1 million victims in DOJ's most recent reporting period. 600 plus defendants charged across 280 enforcement actions. Perpetrators and settings. Six in 10 cases committed by family members. Most abuse occurs in private homes. Pennsylvania system. 52 area agencies on aging serving 67 counties. Reports of need. RONs. Investigated under OAPSA. Statewide elder abuse hotline. Okay, guys, if this ever happens, here's the information. If you see somebody who's elderly getting abused, here's the number for you. 1-800-490-8505. I urge this committee to take bold, decisive action. The cost of interaction is measured not only in dollars, but in human suffering that is preventable. Folks, when someone is abused that's elderly, that is unnecessary. In any state, that's unnecessary. I mean, the elders are our way of preserving old time traditions. And when someone abuses an elder, that takes away from asking about old time traditions. That takes away from the person contributing to future information. That takes away from having their life being safe and secure. When somebody gets assaulted or gets abused physically, financially, it takes away from their right to be citizens. It takes away from their right to have a safe and protected life. Okay, I did this show because this month is Elder Abuse Awareness. So this is my contribution. Hope this helps somebody realize what elder abuse is. For now, Gator Wellness, take care, folks.